Hi, my name's Davina and I'm a diabetes specialist nurse for Knowsley Community Diabetes Service based here in Huyton, and we cover the whole of Knowsley, which is Kirby, Huyton, Prescott and Wiston. Well, we deliver to anyone with type 2 or type 1 diabetes within the Knowsley postcode. We support their GPs, we support the patients themselves if they're referred into the service from their GP. Obviously we do the patient education sessions, we do three different venues around Knowsley. Patients can be referred very easily by their practice nurse or their GP, and they can even self-refer. Well, patient education sessions are often, patients can be put off by the word education, because maybe they might have had a poor relationship or a bad experience at school, but it isn't like school. It's very, very informal, very friendly. We're not teachers, we're not there to tell them off, and people are always very surprised and relaxed. When patients often turn up, a couple of them can be a little bit anxious, and within 10 minutes they're relaxed and chatting away, and it's very much down to the individual person. They can chat away and they can involve themselves, or they can stay quietly and just listen, and we don't we're happy with either way. So we go back to basics and we start off simply with what is diabetes and how to try and educate the patients on self-managing their diabetes, because it is their condition, and to give them autonomy to try and self-manage. We will cover managing illness, managing hypos, preventing hypos, having a healthy diet and exercise, and generally looking after their condition to reduce long-term complications. They are 2-hour sessions and they're run over 2 weeks. They don't last any more than 2 hours, and we give people plenty of breaks and opportunities to have a drink and go to the toilet. They are very interactive, but if people feel a little bit shy and they don't feel confident to contribute, they don't have to. Nobody will be teasing anything out of them. And they're very relaxed and very informal, and everybody always really enjoys it, and they always come back for the second part, which is often the week after. If they can't make the second part, they can always pick it up later on. So if they have work commitments or with children, grandchildren, they don't have to come back the second week. Yeah, I think when people are diagnosed with type 2, they're anxious, they're frightened, they don't know what to expect. And when they meet a room full of like-minded people, they are often leave a lot less anxious and more informed about their condition. We give out booklets to everybody that turns up. So they get a booklet on if they're newly diagnosed with type 2, and they also get a healthy eating plan. They're excellent books, very, very easy to read, and we also give them an opportunity to self-refer themselves into the community health development team for activity, lifestyle changes, so they've got an opportunity to meet a one-to-one counsellor about looking at improving or changing their activity. We get all sorts of people that come through our doors, and we urge people that if they are worried at all, please do come, because the feedback we get is always brilliant, and people have often said that it's changed the way they manage their diabetes. If you are a carer or a family member, you can come along with the person with diabetes as well. So if you are feeling particularly anxious, you can bring a relative, your husband, wife, daughter, son with you, and that's absolutely fine. We have plenty of room. It's open to everybody, so from 16 plus up to 95, any age at all. And if people are a little bit hard of hearing, if they just tell us, and we can put them at the front, and we will always try and cater for people's disabilities. We've had people who have brought their guide dogs before, so nothing's a problem. To the people who've had diabetes for a while, they can come to our education. It is predominantly designed for people newly diagnosed with type 2, but that said, people can come for a refresher, or many people simply have never been offered education before, so they might have been diagnosed 10, 15 years, and that's absolutely fine. We get lots of feedback from people that are well established with diabetes who learn lots and lots of new information. And also diabetes is evolves, and obviously the information that we give is up to date. So we do encourage that. So it doesn't matter how long they've had it, please come along. We offer our GPs within Knowsley area a service called a practice-based clinic, where the GPs will organise certain patient groups to come in who may be struggling to manage their diabetes. They might have high blood glucose levels or be suffering with hypos, or just generally having problems in self-managing their diabetes. So myself and my colleague would go out to the GP surgeries and do a clinic within the GP setting. So patients often like that, and because they often have a good relationship with their practice nurse anyway. So we also offer support to other multidisciplines and other healthcare professionals within Knowsley. So if patients are having a particular problem with their diabetes, they don't have to be referred into our clinics. Most surgeries that we cover, most surgeries in Knowsley, my colleague and I go out and do a specialised nurse clinic there within their GP practice. So it's taking that care closer to their homes and to work with people that know them best, i.e. their GP and their practice nurse. So that's a part of our service that we offer. And also GPs can refer patients into our service, into clinics. And we have one in Huyton, the Bluebell Centre, in St Chad's and Kirby, the Halewood Centre, and at the Whiston Primary Care Resource Centre. So we have 4 different areas where we call them multidisciplinary team clinics, where they're supported by a consultant, so a doctor, and there's a dietitian who specialises in diabetes, and obviously a nurse specialist as well. So that's part of our service.